first of all, accept my sincere apologies that I have not been able to connect with you live today. However, I'm hopeful that I can share my experience with you in this recorded talk, and my 2 cents will give you some food for thought. My name is Dr. Makarand Chousalkar. I'm a veterinarian practicing in Mumbai for last almost 25 years now. I'm born and brought up in Mumbai, the very much concrete city. As a kid, I was always attracted to animals and plants. I would spend most of the time in my garden taking care of my plants, and sometimes you may see me taking care of stray puppies and stray cats. That was the time we were really lucky that we did not have too much of screen time like you have now. We would pretty much go home only for food and to sleep. That's it. Come 1988, when I passed my 12th grade examination, that was the crossroads what most of us are at, most of you are at right now. I was pretty much at the same stage, um, looking for the best possible uh, career for myself, and I found veterinary science was the best. I was contemplating whether to go for medicine or dental or conventional, maybe BSc microbiology or something, but I chose that was kind of a restart moment for me that okay, I have to take veterinary science as my career. So I took admission to Bombay Veterinary College in 1988. Just to tell you, veterinary science is basically it covers quite a bit of subjects ranging from anatomy, biochemistry, and physiology, medicine, surgery, food hygiene, poultry science, dairy science, and etc. etc. So it's a like kind of a vast portfolio where you have to choose what you want to specialize in because um, mere graduation probably may not give you anything or may not find you a good job for yourself. So I was on the crossroads to decide what should I take, whether to take surgery, medicine, or pharmacology or toxicology. I chose pharmacology and toxicology over others simply because I had a good chance of getting into pharmaceutical industry, getting a good job there, just like my father did. My father is a veterinarian and he worked in pharmaceutical industry for over 40 years. So I was looking from that point of view that okay, this looks good. But as I realized that as I was completing my master's degree, I was finding it difficult and it was not really to my liking. I was kind of little disappointed with myself that why did I choose this subject? Um, Fortunately, I had taken some minors in veterinary medicine, so that helped me. After finishing my uh, post graduation, I had to join some veterinary clinic, but those times we did not have many veterinary clinics, private veterinary clinics, and most of them would not offer any job to veterinarians because they were all single owned or single veterinary clinics. So that was a little difficult moment. So I had to take a call, and when I took that call, that was again like I completely changed my. That was again a restart moment for me. That not joining pharmaceutical industry and joining small medicine stream, that was kind of a restart, completely changed. And then I thought of starting my own. So in the beginning, I started my clinic from a small balcony, which was like probably 60 square feet or 50 square feet place. I started and ran for about 2 years. Soon I thought that I should improve on it and I should go for a bigger place, but bigger place were out of reach. So the other moment, or rather a big moment for me, was to start a mobile clinic. So that idea struck me, and then I approached bank. I took some money from my father, and started practicing in a van. That was also a big challenge because practicing in a small clinic, um, putting all your equipment, taking care of plumbing, have facilities for water, fitting an AC, examination table, etc., etc., was not easy. So just because of some clever designing, I could manage that. That I that was a successful venture for about I did that for about 5 years, and then came the next moment where I had to take a call, and then I purchased a 200 square feet place, just a small place, a shop, where I started my clinic. Uh, Eventually, we changed the basically we were also now focusing on other stuff like merchandising, keeping some dog food that gave me some revenue. Dog food was something which was a new thing that time. That was the time where it was just introduced to India. Indian pet population were not known to did not have any access to pet food, ready-made pet food. That was the time it all started around year 1999, 2000. That was the time when it all started. So as the practice grew, I was actually joined by some more veterinarians. I had some more staff, and we were increasing in size as the practice grew. We were more trying to specialize ourselves into having introducing more streams into the practice, like we introduced surgeries into our practice, we introduced dermatology in our practice. So those new things started coming up. We required more space for that. So that moved from one shop, we went ahead with 4 shops. Now we are doing perfectly fine with uh, whatever I could see, well, good manpower, but only thing is that the space was still a constraint. We were a little unhappy with it because we could not provide few things for our pets and their pet parents. So we decided to move further, and just about 1.5 years ago, we moved to a much bigger place. Now that after moving here, things were much better, good place for our patients with good facilities. All we could just offer good laboratory facilities, good surgery facilities, uh, excellent separate waiting areas for dogs and cats. That was something which we always wanted to do because of their unique requirements. So we could finally do that. Now we are absolutely settled down. Of course, we need to do few more things. We would like to introduce more, um, maybe some more equipment to the clinic, but that will happen in due course of time. The why I'm sharing this story is because this would be we have a very unique kind of a facility where we've been challenged with so many problems. Now, to start with the challenge, the first challenge was getting an NOC from a society to start any clinic, a veterinary clinic. We had to face a lot of issues. Um, our society, unfortunately, in general, is not pet friendly. They don't really look to care about animals. Um, Not just the pet owners, but even in general, the society is not really pet friendly. So we had tough times. So finally, each time I had to really struggle to convince, because we initially all the societies were not really ready to offer us a place, but finally we could somehow convince them and then get the place. The other problem we faced, of course, was getting bank loans, because bank loans is something which is a little difficult, because banks never considered veterinary science or a veterinary physician as a professional or at par with a human physician. So we had to convince them. Initially, they again did not give us any bank loan, but again, that was a time where we really requested them, and then they finally agreed to lend us some loan. So then we could move further. So this was a big challenge for us, though probably human physicians possibly may not face this problem. It's a pretty unique problem. Now, other problem is, or other challenge I would say, is to a veterinarian is basically Veterinarians are like general physicians. They are doing pretty much over and above what a human general physician would do. Human physician would just ask you to go to get some x-rays done XYZ, get an ultrasound done somewhere else, or get a maybe a small surgery if you have to do, get it done. But here we are doing everything. I am being a veterinarian, I am also responsible to take care of other things also. As a practice owner, I have to make sure that I take care of my staff, take care of the back office. Sometimes I'm also looking into my laboratory. So it's a multitasking thing, and it's a challenge because you have to keep learning things every day. Every day there is a new challenge thrown to you. So you have to make sure that you have to update yourself all the time. So this was a big thing for us as veterinarians. So other thing which is peculiar, or rather which is also seen in human medicine, is um, patient welfare and medical feasibility. Now, human medicine and veterinary medicine, if you see the practice or whatever efforts we put, whatever training we undergo, it's not very different. Same equipment we are using, same kind of training undergoes, but when it comes to treating animals, possibly the pet parents are not really willing to pay that much money, or they are really cribbing about amount of, like, they are always worried about how much should we pay that much for this kind of facility. We said yes, because we are doing the same thing what a human physician would do, and you consider your pet as part of your family, right? So these are the conflicts, usually these are the conflict areas, but then we have to convince the pet owners, and then convince pet parents, then to and make them understand what kind of effort we put in to take care of their pets. So this is a very unique challenge we have. The other thing is that I would suggest, it's like a common thing with all the medical facilities all around the world, is compassion fatigue, cyberbullying. These are big things now. There is high rate of suicide amongst all professions. Veterinarians are the highest numbers in US. There are studies suggesting that. Such studies are not available in India. However, you're always under threat. People, if they don't like your practice, or they don't like for any reason, they would just start abusing you. Maybe there will be some amount of cyberbullying, which is not good for your mental health. How to take care of that? Because now, as a professional, you are going to take some kind of profession. So make sure that when you take these kind of pressures on you, it's going to affect you. So make sure that you don't get affected. How can you do that? How can you prevent it? So the how would you take mental pressure off you, because it should not be bothering your day-to-day work. If it bothers, then it's not good for your profession. So make sure this is the age where I want you to um, pursue some hobby which is not your profession, right? So anything you can take up, whatever you like. Maybe you like dancing, you like music, or whatever. Like, it could be anything, sculpture or painting, anything. So you must inculcate those habits, and make sure these habits are like they are when you any kind of you are under any kind of stress. These hobbies really help you a lot. So take care of that. When you are in any kind of stress, make sure that you talk to your friends, you talk to, maybe you can take a help of professionals, just to take care of your mental health. Um, Next, I would suggest you is that basically, when we are talking about today's theme is Control Alt Delete, basically a restart. So if you are in any kind of trouble, maybe if you just listen to your heart, don't worry about restarting. It doesn't matter really. Even if you have to restart your career all all over again, don't worry about it. If you have any problems, just listen to your heart and go ahead. Just few points I would like to really stress here is, or maybe you can just, this is my food for thought for you guys is that listen to your heart. Do not let peer pressure bog you down, because peer pressure, pressure from your parents, relations, all this is not really, that should not bother you. If it's your job, if you are convinced that whatever you are doing right is correct, if you're convinced about it, then it's not very difficult for you to convince your parents, right? So do that, because first you get convinced. First, try try to find out what you like the most. Go ahead and do that. Think out of the box. You need not really follow the trends all the time. Choose. You need not really choose a conventional path. Make your own path. Absolutely fine. So because it's just like I did it. I started a mobile clinic, which was really a unique thing which I did, and I'm really proud of it. And it paid me. So something like this, if it happens, absolutely go ahead and do it. Make sure you're legally correct. That's again a very important last point I would emphasize on this, is that many times we are not aware of our rights. So make sure that you know your rights, and take help from take legal help, take help from experts if you have any doubts, and go ahead and have fire in your belly and dream big and challenge your limits is my last mantra to you. Absolutely, because this is the only thing you can really learn from possibly my lecture, that it's just like, just follow your heart. If you have to have any situation, if you have to restart your career, absolutely don't worry about it, just do it, right? Thank you very much again for calling me for this talk, and I wish you all the best for your careers. Thank you.